But the rest of us probably don't realize that some of the most promising tools for healthy aging are already being used on the sidelines of football fields, training rooms, and sports clinics around the country. Now it's up to us to use our jobs in the Senate to embrace innovation wherever it's found and help break the cycle of good ideas coming to Washington to sit on a shelf. In today's hearing, we will explore how the science and techniques developed for elite athletes can be applied to enhance the lives of older Americans, enabling them to stay stronger, recover more quickly, and maintain their independence as they age. As we have heard from expert witnesses in previous hearings, staying active is one of the most effective ways for older Americans to prevent disease, improve mental health, and increase longevity. Too often, Congress holds hearings on problems, listens to solutions, and then never takes action to keep the conversation going and put good ideas into practice. It sounds crazy, but that's the norm in Washington, and I don't think any of our good members of the Aging Committee want to keep following this broken tradition. So I was excited to put this hearing together today with the ranking member at the urging of my good friend, Alabama Senator Tommy Tuberville, to ask an interesting question that perhaps only a coach might come up with. How can we take the lessons learned in sports medicine and all the innovation that goes into injury prevention and enhanced recovery for America's elite athletes and use that knowledge to improve the lives of American seniors? Senator Tuberville has spent his life on the football field, and he's seen just how much sports medicine has changed over the years and how the innovations in this field have helped keep athletes healthier and recover from injury faster. But the rest of us probably don't realize that some of the most promising tools for healthy aging are already being used on the sidelines of football fields, training rooms, and sports clinics around the country. Now it's up to us to use our jobs in the Senate to embrace innovation wherever it's found and help break the cycle of good ideas coming to Washington to sit on a shelf. In today's hearing, we will explore how the science and techniques developed for elite athletes can be applied to enhance the lives of older Americans, enabling them to stay stronger, recover more quickly, and maintain their independence as they age. Sports medicine, with its emphasis on preventing injuries and promoting proper recovery, offers a new pathway to longevity and health for America's aging population. As we consider how to support our seniors, we must draw lessons from the best in the field, literally. The goal is not for seniors to become athletes, but for them to benefit from the same principles: injury prevention, rehabilitation, strength training, and recovery. These are tools for everyone, whether you're playing under the Friday night lights or walking your grandkids to school. As many of you know, Florida has a vibrant senior population and some of the best collegiate and professional sports teams. I'm proud to support them. Today, we will hear from medical experts with real-world experience in treating both athletes and older Americans. We also hear from a former professional quarterback who knows firsthand how sports medicine can help protect against aging injuries and lead to a longer, healthier life. Now I'd like to recognize Ranking Member Gillibrand for her opening statement.
Thank you, Chairman Scott, for today's hearing. What an exciting topic that we get to talk about today. It's great that we get to talk about innovative ways that we can incorporate sports medicine into how we care for our older adults. And I'm particularly interested in how we can increase physical activity and reduce falls for our seniors. A fall can change a senior's life. One fall can take away a senior's ability to live independently. One fall can make an older American afraid to leave the house, increase loneliness, and social isolation. One fall can create a lot of other health problems. I remember when my grandmother broke her hip. It's a common story. When you break your hip, it changes everything, and you really are afraid of going out. You're afraid of being active. You're afraid of doing all the things you used to do. So we have to see what we can do. And I know even as I age myself, I'm 58, mobility is my number one concern. I have to make sure I have ankle mobility, knee mobility, flexibility, all those things. And so I know how important it is for anyone who's aging. Preventing a fall is more important now than ever. The CDC just released a report this month showing that the death rates from falls for seniors aged 65 to 74 rose more than 70% in the last 20 years. But falls are not a normal part of aging. The good news is many things can be done to prevent falls and optimize physical wellness among older Americans. I look forward to working with my colleagues to support and strengthen programs that help prevent falls and increase physical activity for older adults. This includes strengthening critical federal funding for the programs, including the Older Americans Act, and protecting agencies and entities that perform the work. I'm proud to support programs to increase funding for the Older Americans Act programs, including leading the fiscal year 2026 appropriations letter for fall prevention programs. I'm also proud to support bipartisan Older Americans Act reauthorization that was reintroduced last week. I look forward to hearing from our witnesses and figure out how we can make sure people live healthy, active, and fall-free lives.
Thank you, Ranking Member Gillibrand. We are fortunate to have members of this committee who have real-world experience with sports medicine professionals and coaching. With that, I'd like to recognize Senator Tuberville to introduce our first witness.
Thank you, Mr. Chairman. It's my pleasure today to introduce Dr. Lyle Kane from Birmingham, Alabama. Dr. Kane is co-founder of the Andrews Sports Medicine and Orthopedic Center, which he is an orthopedic surgeon focusing on sports-related injuries to the knee, shoulder, and elbow. Dr. Kane is a graduate of the University of Alabama and University of Alabama School of Medicine. After graduation, he served as chief resident at the University of Tennessee Campbell Clinic in Memphis before completing his fellowship focusing on orthopedic sports medicine with Dr. James Andrews at the American Sports Medicine Institute. He currently serves as a team physician for the University of Alabama and as medical director for Jacksonville State, Shelton State University, Tuskegee University, and the University of West Alabama. He also serves as a consultant to the Birmingham Barons and 9 high schools in the Birmingham area. Additionally, Dr. Kane leads an outreach program through the University of West Alabama that provides medical services to more than 40 schools in the West Alabama area. So thank you today, Dr. Kane, for being here, and we look forward to hearing from you.
Thank you, Chairman Scott, Ranking Member Gillibrand, and the members of the committee for having me testify today. My name is Lyle Kane. I'm the managing partner of the Andrews Sports Medicine Group, as Senator Tuberville said. I've been a team physician for several high schools, colleges, professional teams, including the Alabama Crimson Tide for over 25 years. Roll Tide. I firmly believe that the lessons learned while providing care for athletes at all ages, especially in the fields of injury prevention and management, can help improve the health span of our aging population. As you know, the combination of increased lifespan as well as the demographics of the baby boomer generation have led to a dramatic shift in the number of senior adults in the United States, with nearly 20% of our population currently 65 years or older. This has tremendous consequences for our healthcare system, both with increased utilization and increased cost. A true team approach to this individual, using a sports medicine system as a model, can help our senior population maintain a better quality of life as they age. What is a team physician? Well, the American Orthopedic Society for Sports Medicine defines a team physician as someone who provides comprehensive health services for the care of athletes and active people at all ages. The team physician is ultimately responsible for the health, safety, and performance of our athletes. Our duties include injury prevention and risk reduction, acute injury evaluation and management, both during competition and training, chronic condition and illness treatment, coordination of care between providers, and performance optimization. In sports medicine, we also attempt to prevent injury by encouraging rules changes and develop protective gear for each sport. We accomplish these duties through the work of a larger team of providers, and as I'll outline, sports medicine is truly a team effort. The modern sports medicine team includes certified athletic trainers, who are the primary point of contact for most athletes, physical therapists, dietitians, primary care physicians, orthopedic surgeons, psychologists, chiropractors, sports performance specialists, and certified strength and conditioning coaches, and many others. Our relationship with athletes generally starts when we do a pre-participation physical on that athlete to assess their health and physical readiness to play. This is a crucial step and allows the physician and trainer to identify issues that may predispose the athlete to future injury. We do a health history, do a thorough examination, and often do additional testing, such as cardiac testing with echocardiogram, and we develop an individual risk profile for each athlete. In our aging population, the annual examination with your primary care physician can provide this level of risk assessment, but the reality is that issues that put the senior adult at significant risk, such as balance loss, muscle loss, cardiovascular fitness and endurance, and fall risk especially, are generally not evaluated at your annual exam. Employing athletic trainers, physical therapists, and other healthcare providers to assess this risk could likely prevent future falls and the associated health compromise in the older population. In my own family's experience, my 90-year-old father-in-law has seen tremendous results in better balance by participating in a local fall prevention program provided by physical therapists. Why is fall prevention so important? Well, as you mentioned, falls are the #1 cause of injury-related death in the older population. Up to 30% of adults that break a hip end up dying during that first year after surgery. And even the patients that survive past their first year oftentimes never regain independence and require expensive care from rehab or long-term care facilities. It's estimated that falls alone add $50 billion annually to the U.S. healthcare system. The old orthopedic adage wisely states, "We are brought into this world through the brim of the pelvis and often leave through a fracture of the neck of the femur." And that underscores the risk of mortality from hip fractures. Many of these falls are preventable with risk assessment, regular physical activity, resistance training, and fall prevention. So how do we implement this program? Well, it definitely takes a team. The medical team should be empowered to treat this aging patient as an individual with risk assessment, medical optimization, fitness and performance improvement, just like we treat our athletes. Primary care physicians are often the gatekeeper for our older patients, so we have to train these primary care physicians in musculoskeletal medicine. The American Sports Medicine Institute and many programs like it train primary care physicians in non-surgical care, but this requires an extra year of postgraduate training. Physical therapy visits are generally limited by insurance plans, and many do not include fall prevention. And we need to continue NIH funding for this critical disease, especially in my home state of Alabama at UAB. Just 2 weeks ago, the American College of Sports Medicine Exercises Medicine Program launched a program called the Active Aging Initiative for older adults. And this mission is to increase physical activity, work it into routine healthcare examination, and enhance collaboration between healthcare providers and exercise professionals. In closing, we give our athletes the best care possible to prevent injury and optimize performance. We should do the same for our senior citizens. Thank you.
Thank you, Dr. Kane. Now I'd like to recognize Senator Justice to introduce our next witness.
Thank you, Mr. Chairman, Ranking Member. You know, I sit here and just think just a second, but not very often do I have this opportunity, you know, because Dr. Kane, I can't tell you the number of times I've been in the Andrews Institute, and I'm sure you know that.
Yes, sir.
And Dr. Legg and I are long-lost friends and everything. And Coach Hasselbeck, you know, I've watched you forever, and you're a coach, and I love it in every way. And that only leaves Jennifer, the only one that I'm not really in contact with. But Jennifer, thank you so much for all you do in your wonderful state of Massachusetts and everything. And I've got Coach sitting right here beside me, and he's probably wondering, what in the world is he going to say? But here's what I would say, and this is all there is to it. My job right now is to introduce a man that absolutely is a superstar in our state. Dr. Paul Legg, you know, believe it or not, we graduated from the same high school. He was probably higher in his class than I was, but nevertheless, a great, great, great man, an incredible physician. The people of our state depend on this man like you can't imagine. And especially, I'm sure, the elderly, but many, many, many in our state have visited and been recipients of his unbelievable care. You know, Doc, you know me and you know me really well. We had so many interactions with COVID. For 8 years, I was the governor, and through COVID and all that was a lot of situations to where this man rose to the level of a superstar in my eyes in every way. There's no way I could be prouder than to introduce him today. A West Virginia University graduate, an absolute graduate of the same high school that I went to, Woodrow Wilson High School, and absolutely a superstar in our state. So Dr. Legg, take over and take it from here, sir.
Chairman Scott, Ranking Member Gillibrand, and honorable members of the committee. My name is Dr. Paul Legg, and I want to thank you for the opportunity to offer testimony to the Special Committee on Aging. Thank you, Senator Justice, for the introduction, and go Flying Eagles. I would also like to thank my wife of 34 years, Lee, for her support of me and my career. My daughter, son-in-law, and granddaughter are here today, and my son and daughter-in-law are watching from South Carolina. I'm grateful for their support as well. I'd also like to state for the record, the opinions expressed today are my own and do not reflect the viewer position of my employer, Charleston Area Medical Center and Vandalia Health. I'm a practicing orthopedic surgeon in Charleston, West Virginia, having spent 27 years in private group practice and the past 2 years as a hospital-employed surgeon for Vandalia Health. I'm board certified by American Board of Orthopedic Surgery with a certificate of additional qualifications in sports medicine. For over 20 years, I've also been a team physician for the University of Charleston, an NCAA Division II school with approximately 620 athletes. Sports medicine encompasses the prevention and care of musculoskeletal injuries and medical conditions encountered in sports. Lessons from the field, operating room, and research are applicable to maintain physical function and performance in competitive athletes of any age. The health outcomes of seniors improve by keeping them healthy, active, and injury-free as they age. Surgical techniques designed to return competitive athletes to the field of play can also benefit seniors with similar injuries. However, surgical techniques are only a small part of sports medicine's influence on senior health. The manner in which our athletes train and prepare offer many more lessons on improving the health outcomes of seniors. According to the 2022 report by National Health Statistics, only 13.9% of adults aged 65 or older meet federal activity guidelines. The environmental factors to low physical activity are many: cars, mobile devices, sedentary jobs, elevators, computers. Since people get very few adequate exercise at work or throughout their days, exercise needs to be added as purposeful activity. Fitness is partly genetic and measured by how far you go on an exercise test. Physical activity is behavioral and requires motivation and commitment. Increasing your physical activity will increase your fitness. For example, walking is a low-intensity exercise and an appropriate start for most seniors. Poor physical activity and nutrition top the list of the most common health issues encountered by seniors. As we age, our fitness declines. However, exercise can prevent this decline in many patients. Strength training is one of the activities that can improve health outcomes for seniors. The established benefits of regular strength exercise include strength and endurance, increased muscle mass, increased resting metabolic rate, and preventing disability. Both research and experience indicate that resistance training is safe for healthy older adults, for frail older adults, and individuals with disease. Muscle disuse is a preventable and reversible factor. Resistance training is consistently shown as feasible and effective means of counteracting muscle weakness and physical frailty. It improves bone density, it improves metabolic health, insulin sensitivity, as well as improving psychological well-being and reducing the risk for falls and fractures in older adults. So what behaviors can we encourage in senior adults to help start and maintain an exercise program? The first step is making a commitment to increase physical activity. They have to establish protected time to forgo other activities that may encroach on the scheduled time. Set small and realizable goals for exercise, but also think about and establish long-term fitness goals. These barriers must also be addressed. That includes lack of understanding, lack of awareness, and unfortunately, lack of motivation. As I've seen in almost 30 years of clinical experience, health outcomes in seniors can be improved with the lessons we learn from sports medicine and sports science. It's the planned and purposeful exercise and strength training used in preparation for competitive athletic events that provide a structure for exercise in senior adults. Advanced training techniques can also move senior adults from just physical activity and into increasing levels of fitness. Thank you, Mr. Chairman. I look forward to answering your questions.
Thank you, Dr. Legg. Thanks for being here. Now I'd like to introduce our next witness, Matt Hasselbeck. Mr. Hasselbeck is a former NFL quarterback who spent 18 seasons in the league, including leading the Seattle Seahawks to a Super Bowl appearance in 2006. After retiring from professional football, he became a well-respected analyst with ESPN, where he was watched by millions of football fans during Sunday NFL Countdown and Monday Night Countdown. He's also been a vocal advocate for health, recovery, and smart training, both on and off the field. He brings a unique perspective on how the principles of elite athletic performance can help everyday Americans stay active and healthy as they age. Thanks for being here. I look forward to your testimony.
Thank you so much for the kind intro. My name is Matt Hasselbeck, and I'm here to share my insights on the significant role sports medicine has played throughout my athletic career and its ongoing influence in my life. I played quarterback for 5 years at Boston College, followed by a lengthy NFL career. The NFL, if you don't know, is commonly referred to by players and coaches as not for long. But with the help of a great sports medicine group of teams, I was fortunate to play for 18 years with the Green Bay Packers, the Seattle Seahawks, the Tennessee Titans, and the Indianapolis Colts. I grew up as the son of a football player. After an All-American career at the University of Colorado, my dad played tight end in the NFL for 9 seasons. He played primarily with the New England Patriots, but also with the Minnesota Vikings, the New York Giants, and the Los Angeles Raiders, where he and his teammates won Super Bowl 18. My brothers and I all earned full scholarships to play college football, and my brother Tim followed me as a longtime quarterback in the NFL. Most of our wives were prominent Division I athletes as well, and my wife was no doubt a better athlete in college than I was. In the decade since my NFL career ended, I have primarily worked in the sports media space. After spending 8 years at ESPN on shows like Sunday NFL Countdown, Monday Night Countdown, and SportsCenter, I now work as an NFL analyst for Fox Sports on the Colin Cowherd Show. I've also been serving as a high school football coach the past 4 years. After winning a state championship in Massachusetts coaching my son, last year we moved to Tennessee so I could coach on staff with my father and brother, where we coached 2 of my quarterback nephews, Taylor and Isaiah. Taylor is currently committed to play college football at the University of Wyoming. Raising our own 3 kids and supporting their athletic journeys has been the other major career for my wife and me. Our 2 daughters are national champion lacrosse players from Boston College. The younger one is preparing for a 5th year after 4 knee surgeries have earned her a medical red shirt. Our son is a redshirt freshman quarterback at UCLA and is battling for his own opportunity, much like I did at his age. During my 23 years of college and professional football, I only had 1 surgery. This is unheard of. I attribute this to many factors, one of which is the help of skilled athletic trainers and the sports medicine teams. Many of my teammates took a react and survive approach to their health, while a proactive and thrive approach is a mindset that helped me. I attribute this mindset to the advice, care, and expertise of athletic training staffs of my teams. Not only did they help me prevent injuries, but they also contributed to helping me heal faster and return to play. Staying healthy is priority number 1 for an NFL quarterback. Injury prevention, recovery, and prioritizing wellness were equally important to me as throwing touchdown passes. My coaches would often tell us, your greatest ability is your availability. Both during and after my NFL career, I've been dedicated to making the game safer for future generations. I actively participated in the NFLPA's Mackey White Health and Safety Committee and proudly served as the vice president of the NFLPA's Executive Committee for 6 years. Our work successfully fostered a significant culture change regarding brain injuries and return to play protocols in football. In commitment to this cause, upon my death, I have pledged my brain to science through the Concussion Legacy Foundation. I currently serve as the ambassador for the DiagnoseCTE.org study for men over 50, which aims to develop a method to diagnose and differentiate brain trauma while patients are still alive. In this new empty nester era of our lives, my wife and I have experienced the challenges of caring for our aging grandparents and parents. We have leaned on the lessons learned through athletics to help replicate the best outcomes for them as they get older. For example, helping my mom set goals for the activities she hopes to participate in with her grandkids when she is older means that we have to start prepping for that now, much like you would do as an athlete. My mom would love to be able to play pickleball and ride bikes with her grandkids when she is 75. Sometimes it's not that simple. Following a painful knee replacement surgery, my dad was waiting to get healthy enough for the next knee replacement surgery when he tragically suffered a cardiac event this April, which he did not survive. This heartbreaking event has left my mom a widow after 50 years of marriage, and she now faces new challenges, some of which are loneliness and isolation that she must overcome. Sadly, as a family, we are also dealing with the significant challenge of my mother-in-law's Alzheimer's disease. This illness has placed an immense hardship on our family, particularly affecting my father-in-law, who sacrificed his profession to become her full-time caretaker. In conclusion, that's a glimpse into who I am. I'm truly honored to be here today. The last time I visited this building was on my 8th grade class trip. I had a great time, and I'm hoping that I'll get to come back again, so thanks for the invite.
Thanks for being here, and sorry to hear about your dad. So it's tough. Whenever your parents pass away, you wake up and you think, oh, I've got to call one of them, and then you can't call them. So now I'd like to recognize Ranking Member Gillibrand to introduce our last witness.
Thank you, Chairman Scott. I want to introduce our final witness, Jennifer Raymond. Ms. Raymond serves as the Chief Strategy Officer at AgeSpan, an area agency on aging in Lawrence, Massachusetts. Through her position as Chief Strategy Officer, Ms. Raymond oversees AgeSpan's evidence-based programs, including its falls prevention efforts. Additionally, she holds a Juris Doctorate and has been recognized by the John A. Hartford Foundation as a national practice change leader. Thank you for being here. You can begin your testimony.
Chairman Scott, Ranking Member Gillibrand, and members of the committee, thank you for the opportunity to come and speak with you today. My name is Jennifer Raymond, and I'm honored to serve as the Chief Strategy Officer for AgeSpan, one of the area agencies on aging located in Lawrence, Massachusetts. We are one of 614 AAAs across the country, helping older adults remain independent in their home. On behalf of these agencies, as well as the older adults and the family caregivers they serve, I want to first thank all of you for your ongoing efforts to meet the needs of our aging population through the Older Americans Act. And thank you for your attention on the importance of physical wellness for older adults. The consequences of physical activity among older adults are catastrophic. They include a decline in overall function, increased risks for chronic diseases, increased frailty, and a heightened risk for depression and cognitive decline. Yet despite these consequences, more than 1 in 4 older adults are physically inactive. The reasons for inactivity are many and varied: a fear of injury, lack of confidence in their ability to exercise safely, and even a lack of motivation to begin exercise. Throughout this country, area agencies on aging and their partners offer effective physical activity programs that both promote exercise and help individuals overcome those motivational and behavioral barriers that contribute to inactivity. For example, there's May C. from Quincy, who was able to safely abandon her walker after improving her balance through an evidence-based program called A Matter of Balance. And Maria A., who, despite her frailty, now participates in virtual physical activity classes from the comfort of her own home, thanks to a AAA's digital access program. One of the most important benefits of increased physical activity for older adults relates to the prevention of falls. Falls can be detrimental in a senior's life. They can result in hip fractures, head trauma, other serious injury, and even death. They often reduce mobility, take away a senior's ability to live independently, and can make people afraid to leave their home, increasing loneliness and isolation. Every year in this country, more than 14 million Americans 65 or older, that's 1 in 4, suffer a fall. In 2021, emergency room departments reported 3 million visits due to older adult falls. And the total healthcare costs for these falls are over $80 billion per year. Of these costs, 67% is paid for by Medicare, 4% by Medicaid, and 29% by older adults and families. Today, many area agencies on aging partner with family health centers, primary care providers, and managed care to reduce falls risks. First, our healthcare partners screen and identify older adults who are at risk for falls. Then they refer these individuals to networks of AAAs for falls intervention. This intervention might include a physical activity program. It might include assistance with home modifications to address home hazards, and even the provision of medically tailored meals to make people more able and ready for physical activity. These referrals from our healthcare partners allow us to take a more holistic approach to addressing the needs of the individual and create a shared care plan to improve outcomes. There is much we can do to support older adults in their desire to age in place, stay physically active, and avoid falls. To further these goals, we must support robust funding for community-based physical activity and falls prevention through the Older Americans Act, specifically Titles 3D, Evidence-Based Health Promotion and Disease Prevention, and Title 3B Support Services. Educate healthcare providers about falls prevention through tools like the STEADY program, which assists providers in integrating falls prevention into their clinical practices. Encourage prescription for physical activity and falls prevention by healthcare providers and allowing for appropriate reimbursement for effective interventions offered in the community. And continued investment in research related to physical activity and falls prevention for all older adults, those with physical frailty, those with disability, and those with cognitive decline. If we are serious about a healthier America, we can't ignore the impact of physical inactivity and falls among older adults. Area agencies on aging stand ready to partner with healthcare, older adults, and family caregivers to address this challenge. Investments today will not only allow older adults to thrive independently, but will also stem the cost for our healthcare system for years to come. Thank you again for the opportunity to speak with you today and for your support on this important issue. I look forward to your questions and working together to support our country's older adults.
Thank you, Ms. Raymond. Thanks for what you do. Now we'll start with the questions, and Senator Justice, if you want to start.
Well, I could start with any of you, but I really am always intrigued by just this. You know, Dr. Kane, you at the Jimmy Andrews Institute, you probably have many stories to tell. And with all that being said, I'd like you to just elaborate, if you could, just on this. Over the years, you especially have seen so much progress being made towards our seniors and what can be done. So just elaborate in your words. Your experiences with Jimmy Andrews, I know, are just limitless. But absolutely, in my opinion, you know, Jimmy is a terrific friend, been a friend forever and a day. So please tell us more.
Thank you, Senator Justice. Dr. Andrews has been a great mentor to me. And, you know, Dr. Andrews retired 2 years ago and is now kind of in a stage where he's trying to take care of his health more than he used to instead of working so hard. And you have a great point. I mean, we have had great advances in sports medicine, taking care of teams, and medicine in general over the past 30 years. But the reality is, I think in medical care of our older patients, most of our time is spent dealing with complications on the back end. There's very little time spent on preventative care. And if you take the typical primary care physician that sees an older patient, internal medicine, family practice, or another physician, they spend most of their time dealing with heart disease, high blood pressure, and other things that are already kind of the cat's out of the bag and they're just trying to manage. I think the way we get on top of this and the way we treat this better is we treat our older patients just like we treat our younger athletes. We try to work on preventative programs, things like Ms. Raymond's doing, and we spend more time with our office visits talking about how to prevent disease than how to treat diseases the patients already have.
Well, I know you're doing unbelievable work, and, you know, I can tell you the many visits that I've had there have ended up, you some way, somehow patched me together, and I've made it this far anyway. But Matt, I've got to ask you just this, not to not ask Dr. Legg wonderful questions but Dr. Legg and I have been around many, many, many times on many, many different things. Matt, I watched you play. You were a superstar. You have absolutely a family of thoroughbreds like you can't imagine. And through all of that, you have a message to pass on to all of us and all the different things that you know that we can do better at. You took care of yourself. You took care of yourself in a really proactive way, and you're exactly right. NFL athletes don't usually stay there long, and you stayed there forever and a day and made a contribution every single time you went on the field. But tell us more. Tell us more about really what we should be doing. I listened intently to all the different folks in your family and all their incredible accomplishments. Now I want to hear from Matt. Matt, what do you think we really need to be doing?
Well, thank you for your question. I mean, I really agree with what both doctors said about being proactive, stability work, falling. At football, running backs don't want to fall because you're down. So you practice balance all the time. You practice with your eyes open, you practice with your eyes closed. That's something that I would do as a quarterback. It's something that I would do with my mom. She would do with her mom. I think these are lessons, using some of the injuries that are common for quarterbacks. A high ankle sprain is an injury that you have. We would do what we call prehab. It's preventative rehab. We would do the rehab as if we had an ankle sprain, a high ankle sprain, before we even had the injury. Or even coming back from my one surgery, which I had down in Alabama, which was not convenient living in Seattle, but it was great and was successful. But one of the things that we did with the athletic trainers, we practiced falling. I went from being in a sling for many, many weeks to I had to somehow get from the sling to back on the football field, getting tackled by guys like Michael Strahan. And what are we doing in the meantime to get there? Practicing falling was really a great return to play protocol that helped me coming back from surgery. When I felt frail, I felt afraid to fall, but doing it in a controlled environment is one of the things that gave me confidence, gave me athleticism, and got me back to feeling like I could go protect myself in the arena of athletics.
Thank you, sir. And I practice falling right now, but it's really not on purpose. Anyway, thank you so much, sir.
Senator Gillibrand.
Thank you, Mr. Chairman. Jennifer Raymond, the importance of federal funding for programs that support older adults. You have discussed how Age Span provides critical services for older adults in Massachusetts. Those services include physical activity and fall prevention programs. Age Span and other area agencies on aging provide those services through a partnership with the federal government. The services are locally run and tailored to individual communities, and the federal government helps with funding, research, and technical expertise. Can you give some examples of Age Span programs that have received federal support and how those programs have helped older adults? Can you talk about what will happen to these programs if their federal support disappears?
Yes, thank you. I think that it's been over 50 years that area agencies on aging and the people that we serve have benefited from a really good partnership with the federal government through the Older Americans Act. Through Title III-D, we have those evidence-based programs like A Matter of Balance, Enhanced Fitness, all of those things that allow us to provide programs to increase physical activity and reduce falls in a safe and effective way, and programs that have demonstrated some efficacy. But in addition to that, the Older Americans Act through Title III-B has allowed us to provide a wide range of support services. At my agency alone, we serve 28 cities and towns, and we receive over 25,000 calls every year to our offices for information and referral. These are not people who have a case manager. These are not people that we're serving, but these are people who are wondering how they get services, who are wondering how they get help in applying for Medicare, those kinds of things. That information and referral support work is funded through the Title IIIB of the Older Americans Act. In addition to that, I don't think we have to talk much about the Meals on Wheels program, but home-delivered meals, medically tailored meals. This year, we provided over 1 million meals to older adults who were frail and in-home and otherwise unable to receive nutrition and food services. But even beyond the Older Americans Act, we have benefited, and many community-based organizations have benefited from pilot funding from the Administration for Community Living or from CDC in order to implement these evidence-based programs in a way that can be effective and improve health outcomes, but at the same time, look at how they save dollars. So there is a wide range of ways that we continue to support, to continue to thrive under the support from the federal government.
Thank you, Jennifer. Dr. Kane and Dr. Legg, can you talk a little bit about what happens to older adults after they fall? And can you talk about the importance of patient education on reducing falls?
Thank you, Senator. I think, once a patient falls, there's kind of two outcomes. One outcome is they break something, they end up in the hospital, and they're probably never the same, honestly. The other outcome is that they get lucky, they get scratched up, they go to the hospital, get checked out, and they go home. But very rarely do we do any fall prevention with those patients, even the ones that have fallen. And we have our own families that we know that have fallen, our grandparents or parents. And you kind of count your blessings that they made it and that they didn't hurt anything, but very rarely do fall prevention programs become part of the treatment algorithm. So I think, for us as physicians, backing up a second and saying, hey, we're taking care of all these diseases and all these problems that are caused by balance and fall issues, why not prevent those? And I really like the program that Ms. Raymond's talking about. I think having the primary care physician as the point person to encourage that is really important.
Yeah. Dr. Legg?
When we talk about falls, we tend to worry about people who break their hips. And that's a very serious injury, and it creates fear afterwards. But I also see many patients who break a shoulder or proximal humerus or a wrist, which is sometimes just as devastating because they're immobilized, which really throws off their balance and puts them at much higher risk for additional injury. Preventative programs are essential. We also have to look at how can we improve the thing that makes them at high risk for fractures, and that's bone density. And how do we improve that? How do we test for that? A lot of it, again, is encouraging the patient to get the testing done, and then encourage them to be consistent and compliant with the medications that help, because they do help and they do reduce the risk of fractures. But once they have a fall, sometimes it's motivating them to overcome the fear that they have to be active again. Many of them often become scared and afraid of exercise and afraid of movement, which puts them at even higher risk for medical problems.
Thank you. Thank you, Mr. Chairman.
Coach Tuberville.
Thank you, Mr. Chairman. Thanks for being here today. 35 years of coaching, I saw a lot of injuries. I think that there's tremendous improvement in surgeries over the years. Obviously, the orthoscopic surgery, instead of slicing the knee open, we did a lot easier and a lot quicker back on the field. Dr. Legg and Dr. Kane, just talk about one other thing that's really improved and how much we need to continue to educate people and hopefully get more people in this profession is physical therapy. My players, I'd always tell them the surgery is what's easy. Therapy is the hard part, just getting back on the field. Dr. Legg, you first.
Physical therapists are essential to what we do in sports medicine. And they're also essential to rehabilitating our seniors who have any injury or surgery. I use the physical therapist very often now in joint replacement surgery. As I've become older, my patients have aged with me. And people who I did arthroscopic procedures on years ago, I'm now replacing their knees and their shoulders. And the physical therapists are the ones who really get them back to movement and strength and activity, because a knee replacement or shoulder replacement is a painful operation. And the physical therapists teach them what to do, but they also encourage them to do it. And sometimes that's the hardest thing, but they're invaluable. My son played college football and needed the physical therapist on several occasions to keep him in the game. So we need physical therapists, and they are invaluable in treating the patient.
Thank you, Coach. As you know, the other part of that equation that's really important is athletic trainers. Certified athletic trainers are kind of the point person. Matt Hasselbeck mentioned it in his talk, that they're the ones that kept him from getting hurt. And I think the combination of an athletic trainer and a physical therapist are really critical in the team model, and really not only for injury prevention, treatment of injuries, rehab after surgery. They're the ones that do the grunt work. We as the physicians, we may see the player for injury evaluation and surgery, but these are the people that are with them every day. And I think that's really the model you need for the older population, is you need those providers, ATCs and physical therapists, in the system and keyed in to where they help the older patient follow through with those demands, to make sure they're doing their exercises, to make sure they're doing them correctly, and to treat them just like we treat an athlete. The athletes are in the training room every day, all day. Obviously, we don't have that ability as we age to be in the training room all day, but you need someone that keeps up with the person longitudinally and make sure that they understand what they're supposed to do. And we have a shortage of both, a critical shortage in athletic trainers. They have to get a master's degree now to graduate and to be certified, and there are just not many kids going into it now. So we have a critical shortage of trainers. We don't have enough physical therapists, and physical therapy visits aren't covered very well by insurance. And so it's a big problem for seniors trying to get treatment.
Thank you. Matt, you and Ms. Raymond, if you'd answer this question. Another improvement I've seen over the years, obviously, and this is as much for adults our age as anybody, nutrition and supplements. It's been a huge improvement. Matt, your thoughts on supplements, and I know you've taken many over the years, and try to eat right also, right?
Yeah, I think we could improve the cafeteria here from what I saw today, by the way. I would just like to also add, I think that when you get hurt, it's very depressing. It's embarrassing. You feel isolated, and it's depressing. And, the athletic trainers are just a confidence giver to you and a daily sort of like a pep in your step person in your life. So it's very important. And they advise you also on the best way to recover. Hey, you can't do this right now, but what can you do? Well, we can make better choices with our nutrition, or maybe it is protein. I know for athletes, protein's a very, very important thing. I know for older people, protein's a really important thing. But I can't speak enough. I think about the best friends that I had on my football teams. A lot of times it was a teammate, but usually there was an athletic trainer in there as well, because that was literally the person that was every single day. And to hear that there's a shortage, there's a lot of people that get into athletic training because they were athletes as high school kids and they love sports, but genetically they can't play professional. But you can still get a Super Bowl ring as an athletic trainer if maybe there's a pathway to study that in college, and we invest in that. I would be all for that. It meant a lot to me.
Ms. Raymond?
Put your mic on. Turn your mic on.
I knew I was going to do it. When you all are talking about the athletic trainers and the role that the athletic trainers play as part of the larger team, I think of the equivalent in our community-based organizations, those case managers, the community health workers who are working with the older adult every day and saying, yes, I know you're frustrated that you're not able to play pickleball the way that you did last year because of your hip injury, But let's talk about walking. Let's talk about doing some chair exercises that will get that mobility going. And by the way, we'll also sort of talk about medically tailored meals that we can bring in that will add to your ability to be able to feel well enough to do that activity. So I think that team approach is one of the key ways that we on the social care side also think of is really strongly to be able to support older adults in their physical activity.
Thank you.
Senator Husted.
Thank you, Mr. Chairman. Thanks to all of you for being here today. My wife is a physical therapist coach, so I know exactly how valuable they can be, because what I've witnessed as a former athlete and a coach, and also with a wife who was a marathon runner and into her 40s, and as a physical therapist, is that things build on one another. How an injury or a sore knee, you don't walk anymore. You maybe don't walk as much. You start to eat a little bit more. You start to put on a little weight. These things can really begin to compound on you, just like healthy habits can as well. And so I ask any of you who would want to respond to this, how do we reach people with this message? What are the most effective ways that you have found to help people understand that, hey, and at what age does somebody really have to start paying more close attention to the issues that will compound and then affect them and make it very difficult for them as they get older? And welcome all of you to comment or give your thoughts on that, how you reach people. What do we got to look at here?
I'll start. I mean, I think there's some simple educational materials, simple public service announcement type things. I mean, if I'm 57, I think when you're in your mid-50s, you probably need to start thinking about this. It's not 65, because you're starting to lose balance. You're starting to have, your body changes physically, as we all know, as we get older. Not only can you not see very well, but your joints don't move as well, and you get other problems.
Yeah, the effects of gravity do, for some reason, get a lot worse as you get older, right? So.
No doubt. So, I think if you give it just some simple stats, I mean, there's a stat that's pretty well documented that a simple physical education treatment program, so doing balance training, fall prevention, and not falling, probably adds 10 years to your life compared to not being physically active. So, if you have a simple public service announcement that says, hey, if you're physically active at this level, you're going to add 10 years to your life. Think about all the people taking all these supplements and doing all these longevity courses and all these things to try to live longer. That's the simplest method to live longer. I think we just have to educate people.
This becomes important very early, Senator. We know through studies that something we call sarcopenia, or loss of muscle mass, starts at between age 35 and 40. And it goes 5% a year. So we really need to start earlier. We also know that through some of the tests, which are older tests in the 70s from Dr. Robert Bruce, that what we call VO2 max, okay, for the most important muscle, the heart, okay, and how we develop energy through our muscles, that starts to decline also. And the good thing is that decline can be improved and reversed till about age 70. And then it's very difficult after that to reverse much of the aging process to the heart. So inactivity is bad, but we also know that someone who's very sedentary, the people who make those first steps into activity get the greatest benefit from being active. Now, the steps become, a little more incremental as you go up, but it's just that first movement from sedentary to any kind of activity. And when I have sometimes students or residents, I tell them that you have to listen to your senior patients, but you also have to be a motivational speaker. Okay, you've got some answers for them. You just got to convince them that they need to do it.
Sorry, can I just add quick? We use this phrase all the time, sitting is the new smoking. and we sit so much. Even as a professional athlete, you sit all day in meetings, practice for 2 hours, but getting up and VO2 max training is very important. But zone 2 training, power walking, a brisk walk is very important, I think, for someone in their 30s, 40s, 50s. Having that foundational piece is super important, and doing that in groups, messaging, but also as friends, make that normal. Right now, sitting all day is normal. Make power walking normal. That's the advice I would give my friends.
I would agree with much of what's said now. It's very exciting for us when we're able to take a more upstream approach, when we're able to reach people before they have diabetes or before they have COPD and be able to work with them on the kinds of behaviors that will prevent that. It's very exciting when we get to work with family caregivers and the older adult and see the family caregiver say, gosh, I'm 40, I'm 50. Now's the time for me to start this physical activity so I can be more independent as I age. At the same time, we are coming across folks who are in their 70s, in their 80s, and even in their 90s that are looking for ways to be physically active, but they have chronic pain, so they worry that physical activity is going to exacerbate that. We're able to have those community health workers and case managers sit with an older adult who thinks they can't exercise and talk to them about what is important to them, not what's the matter with them, but what matters to them. And I remember an individual named George who diabetes, COPD, chronic pain, did not feel like he could do anything, but his case manager talked to him and said, well, what's important to you? And he said, I want to play with my grandchildren. I want to be able to have that relationship with them that I had with my grandparents, and I can't do that now. And that was the trigger to say, well, let's start with this walking class. Let's start with brisk walking. Let's move on from something there. So even though our goal is to reach people on the upstream, there are still many powerful ways for us to encourage and support traditional older adults who want to be physically active.
Great. Thank you. Thank you, Mr. Chairman.
Thank you. Apologize for not being here earlier. We have crazy schedules. I'm taking over Senator Scott as chair. First of all, I think it's an interesting hearing. Being elderly myself nowadays, mentally I'm not elderly, but I certainly feel it in my body. Dr. Kane, can you just talk a little bit about the importance of protein? It's one thing I'm hearing more and more about and it's actually very difficult to eat as much protein as you see recommended. Can you just kind of address that issue?
Sure. Thank you, Senator. I think protein has become kind of the most critical element we know in nutrition to keep you healthy. We found over years that super high protein diets are actually very good for you. And the more protein you eat from a relative standpoint, the higher your muscle mass, the higher your health, the more energy you have. And a lot of senior adults have a very poor appetite, and they don't get much protein. So things like protein supplements, protein shakes, I encourage my patients all the time. There are studies recently about creatine, just a little powder of creatine, 5 grams of creatine, a small scoop a day can increase your longevity. And so I think protein is really critical. It's hard to get it by eating just steak or fish or meat. So I think you almost have to have a supplement to get enough protein these days.
So I do kid my wife because she does all the health research in our family, and she's buying different supplements all the time. It's like, well, you don't even really need eat a meal. You've got more than enough right there. Talk about it, maybe Dr. Legg, talk a little bit about nutrition versus the supplements, and is it equivalent? I mean, can you do it through supplementation? And just kind of talk about that balance. Part of our problem is you read different things from different people, and you're not quite sure what's the truth.
The difficulty with many supplements is that supplements really aren't under the oversight of the FDA. They're not tested in the same way as drugs are tested. Now, we know that many supplements have a lot of testing. Dr. Kane, you mentioned creatine. It's kind of the it supplement at this time, but seems to be one very safe and also a very good supplement to help increase muscle mass. We also know that now it may help bones, and then if you take it long enough, it may help our brains also. Now, what I like to encourage people as far as nutrition is to be as unprocessed as possible. It's difficult these days, but food that is unprocessed, I think, is the best, okay? I think that supplements are needed for the areas of deficiency. Yes, protein is something that everyone need. Now, testing can be done if you have certain areas that maybe you need vitamin D, maybe you need vitamin C. Those are very important. We know the heart benefits of omega fatty acids. Those are also a very good supplement for people to take. It's just really finding, based on your diet and your activity, what you may need. And you can coordinate that with your family physician, but there's a lot of information out there. And again, I encourage my patients to try to be as non-processed as possible with their nutrition, and then supplement in areas where they may be missing.
I think that Secretary Kennedy, I think, is definitely looking at that in terms of the MAHA movement, and people like Dr. Casey Means has had the same message. But you mentioned the supplements do not have the same rigorous standards for testing. Are there testing labs? I mean, is there, when you're looking at for a supplement, is there something that can guide you that you can be reasonably assured that this is coming from a quality lab and not some cheap import that might have questionable ingredients? Again, I think that's a serious concern.
It is, and I tend to have people get supplements from what I call reputable sources. Okay, I tell them to buy it at a I hate to say it this way, but a notable chain, maybe grocery store or nutrition store. I tell them to be sometimes wary of where they buy it online. There are certifying agencies for nutritional supplements, and they do give really a third-party look at what's safe and even sometimes what can be effective. But I tell them use reliable sources of where they buy their supplements.
Okay. Well, Mr. Hasselbeck, not to make this too personal, but before I did this silly thing, becoming a U.S. Senator, I actually had a pretty good exercise routine. I'd go home and I'd be watching the news, so why not hop on a Life Cycle or a Nordic Track? So that worked for me pretty well, and then all of a sudden, as you know, my ranking member here would testify, it's kind of hard with our kind of schedules. So I literally was losing muscle mass. So what I have decided to do is, for example, making a Keurig coffee. It's about a 3-minute process, and there's calisthenics you can do. And I've seen that has been incredibly helpful to me. I've seen just on, for example, X, they have different Chinese methods, different types of exercise, and they work very well. I'd imagine you know something about exercise. Do you have a routine or something you can recommend for seniors?
Well, I would just say a couple things. First, just real quick, like to piggyback up on the protein and the creatine. I 100% agree with that. I think there's a stigma with creatine, like it's not safe. It's been around for years. It is safe. As an athlete, you're deathly afraid of testing positive with something like a substance, a non-reputable source. But even that's dangerous. We always, as an athlete, went by the NSF certification process. That at least gave you the strongest sense of like what they're saying is in the ingredients is what is in the ingredients. But for us, just plain powder and plain creatine are pretty safe. To your question about the routine, I think as an athlete, we have it easy because we set goals. I played until I was 40 in the NFL. I was still playing when I was 40. My friends that were 40, they were like, how are you doing it? It's like, I don't know. I think it's just use it or lose it. And I set goals. I had a game every week. I had a goal that I had to attain. So much like I spoke about earlier with my mother, Mom, what do you want to do when you're 75 years old? Well, I want to be able to board an airplane by myself. I want to be able to put my luggage up by myself. I want to be able to pick up my grandkids. What do you want to do when you're 85? Like, same thing. When you have those goals, I think it's so easy to come up with what the exercises are going to be. I want to be able to get up out of a chair without using both hands to help me get out. Okay, well, then I know the exercises we need to do. And you can see, physical therapist, athletic trainer, your doctor to help accomplish those goals. But to answer your question, setting goals is the number one way to accomplish them. My dad used to say this all the time. A goal without a plan is just a wish. And so that would be my answer.
Okay. Well, Senator Gillibrand, do you have any further questions?
Yeah, I have a few. We're filibustering because we want the chairman to come back and ask his own questions. So we're going to ask you a lot of questions and keep you busy. So I want to go to, for Mr. Hasselbeck. I've read about the stigma of seeking medical treatment, including preventive treatment, especially for athletes and older adults. Can you talk about what we can do to reduce these stigmas so that people can get the help they need?
Yeah, I think there is in particular with what our family is going through right now, it's hard sometimes to ask for help. And when I was in the NFL, my first year in the NFL was 1998. At that time, if you ever had a concussion or you ever had a brain injury, and the athletic trainer, the doctor, a teammate, or a coach said, "Hey, how are you?" You would just say, "I'm fine," no matter what. Even if you couldn't see straight, you were dizzy, you were throwing up, you would just say, "I'm fine." That was the only acceptable answer if you were going to be tough. And we worked really hard to my last year in the NFL, which I believe was 2015. We sort of made it cool to be honest with the medical team. There was a little bit of distrust that like maybe they're not going to think I'm tough enough, or, I don't know what it was. But it was really hard to kind of change the culture in football and pro football, which we believe trickled down to college and high school, where it became normal to, if the doctor asks you a question or the trainer, athletic trainer, just be honest with them. And that was really hard for our community to do that. And I think I do see some similarities with if you are a caretaker of a loved one at home, maybe sometimes it's hard to just ask for help. But that was a tough thing for us. I mean, even just the learning process, looking in the mirror through that process was one that was a lot tougher than I thought as an athlete.
Well, I remember reading a story about dehydration and how a high school coach wasn't allowing the players to hydrate, and a boy died because you were not perceived as tough enough. So I hope that trend of, again, for the professional athletes, so it does trickle down to high school and college, is that your wellness is the most important thing for the players. That part of the team's goal is to make sure you are 100% well, whether it's mental, physical, injuries, or the like.
Yeah, and I would just say, and the medical professionals here can speak to this better than me, but as a high school coach, we're trained for heat illness and heat exhaustion and those types of things. But I remember when my dad was playing in the NFL, it was seen as a sign of weakness if you were to ever give your players water breaks.
Yeah.
And now we know that through science that's foolishness. And so I think as a player and as someone who loves sports and loves the game of football, inviting the medical community to really help us learn and not just do things the way that we've always done it. And I would say the same thing for the aging community. I think we can start way earlier than 65 if we want good outcomes when people are 70 and 75.
Smart. Jennifer, can you talk a little bit about some of the evidence-based physical activity or fall prevention programs at your AAA? And could you talk about the importance of evidence-based programs and how we can support the development of more proven interventions to help the seniors?
Turn your microphone.
Tick your mic.
Good. One of the evidence-based programs that gets offered very, very widely across our communities and across the country is an evidence-based program called Enhanced Fitness. And Enhanced Fitness is all about physical activity. This is a group class, up to 25 people in a class. It's run by a trained, certified leader who understands not only how to do the exercises, how to do them safely, and how to look out for challenges that the older adults may be having while they're exercising. balance, strength training, mobility, all of that being part of the program. But one of the things that makes a program work best is just what others have said, the goal setting component. So how am I going to get from where I am in week 1, where I can barely do the stretching from a standing position, to where I want to be in week 8? And how do I do a little bit at a time in order to do that? That's an evidence-based program that has had some significant research behind it as well. So it might cost around $1,000 to $1,200 a class, not one class, but the full evidence-based program. And a retrospective CMS study showed that people who participate in that program save a healthcare cost of around $1,000 a year. So you figure 25 people in that class, you're going to make up for it. That's what's incredibly important about the evidence-based programs and the federal support for it. We want to be good stewards of federal dollars. We want to initiate and offer programs that have good outcomes, that are going to help a person stay independent longer, that are going to increase their ability to stay strong, that are going to increase their ability to be mobile, but at the same time are going to bend that cost curve over a long term.
Thank you
that's
so
what the
much,
evidence-
Jennifer. Thank you.
Okay. Well, first off, thanks again for everybody for being here. So Mr. Hasselbeck, how many hours a day do you have to spend time to make sure you're healthy? What's it take?
Would you say right now, or what's
Right now. What's the difference? And what's the difference? between
Well, I
it's like-
spoke earlier about what I'm terming zone 2 training.
Yeah.
And, these ideas aren't necessarily my ideas. They're ideas that get talked to me by people that I trust. But I do believe that kind of that zone 2 cardiovascular, it's good for my heart health. It's good for brain health. It's good for muscle. It's good for bone density. It's good for all the things. So I think strength training at least 2 to 3 times a week. And I think breaking a sweat, heart rate over 100, at least I would say 5 to 6 days a week. That to me would be seemingly like the floor of what I would consider to be healthy exercise.
What do you do on your diet?
Diet, I think I would agree with what's been shared already today. High protein, less sugar, very, very little sugar if you can. Not a lot of refined carbs. I'm a little bit guilty on that right now. But truly and honestly, I think, again, setting goals and having people in community kind of holding you accountable and having fun with it, that's what I saw as an athlete. I think even now as a former athlete, I've been to a few funerals lately, and I've seen a lot of my former teammates. A lot of them are offensive linemen. Those guys are having so much fun getting fit and losing weight, and they're on a roll with it. And I do believe that the fact that they're doing it together is encouraging, like, I don't want to say a competitiveness, but almost like you're cheering each other on in a way. It's inspiring, it's contagious, and it has a multiplying effect, which is really, really cool to see.
Dr. Kane, Dr. Legge, in your communities, what have you, what's your, like, if you're going to go brag about somebody that has a great program for a senior, which one would you brag about?
Yeah, I mentioned in my opening comments, Senator Scott, I think in our community, the fall prevention programs have been really helpful. I've had my own mother and my own father-in-law in those programs, both one at 85, one at 90. And I think, physical therapists, athletic trainers that are not bound to some of the time constraints of a primary care physician can spend more time with the older patient, get them comfortable with the program, have ability to make sure they're safe doing it, with things like wobble boards and balance maneuvers that can really make a dramatic impact on the patient's risk of falling. And I think the fall prevention programs are really the key to our community trying to keep people healthy.
Dr. Legge?
In my community, we have something called West Virginia Health Right, which is a free and charitable clinic that started many years ago, but it's grown. Some of the new services they offer are nutrition, which they have at 2 different locations, and exercise classes at the same locations. The great thing for patients in the Kanawha Valley is that they're free. Patients can learn about nutrition, learn about cooking, but they can also go and participate in exercise class, which includes aerobic exercise training as well as strength training. I work at this clinic. It's a very well-organized place, so it's a great opportunity for people in Charleston.
Mr. Raymond, besides the program you have, is there any, so where you live, is there anybody that you could send a senior to that would be all-encompassing, that say, this is, if you do these things, you're going to do what both of the physicians talked about, you're going to live longer, you're going to be happier, and all those things?
You know, we do take a community-wide approach to this kind of work. So being able to partner with the federally qualified health centers, the family health centers who are seeing a lot of folks who are at risk for falls, and being able to partner with that physician group is important. Partnering with the YMCA's PACE programs. There are a lot of these kinds of programs. I think the incredibly important part for us is that we're often the first folks that an older adult is seeing or coming to us in the senior center. And so making sure that we understand the wide range of community resources that are there is incredibly important.
Mr. Hasselback, who would, you don't have to give this name, but so somebody that you'd say is 80 years old, that you would say, boy, they've done it right. Who would you look at and say, they've done it to stay healthier longer?
Well, my grandmother passed away this past year. She was in her mid-90s. She had 12 kids. And I think the great-grandkids kept her very active. But she's someone that I would point to in my life that I'm an eyewitness to that stayed very active. She was a great golfer. She golfed with the women at, in her neighborhood. She's kind of infamous. She was a left-handed golfer. But, I think just her daily activities. She stayed active cooking. She stayed active, again, like reaching down, picking up grandkids, holding them, passing them off. Those are activities. And I think, seriously, like I've talked with my mother about this. What are the activities that you want to be doing when you're that age? If it is that, like, let's go get a dumbbell and let's practice squatting. A 30-pound dumbbell is probably like a 20-pound toddler. What are the activities? If you want to be able to do certain things, maybe we need to walk steps a bunch of times. Maybe we need to focus on walking steps sideways, both ways. If you want to play pickleball, training like an athlete, but knowing that the exercise that we're trying to train for maybe isn't an athletic event. It's traveling on an airplane without feeling like you need someone to help you. It's walking through a large airport. Maybe it's going for walks. Near the end of my dad's life, knee replacements were the thing that slowed him down. He was otherwise completely healthy, but the knee replacements kind of shut him down in a way. He couldn't do the very basic activities that it was kind of tough. And so I think if we had been more proactive about that kind of stuff, there's health span, there's lifespan, and then there's health span. Sure, you lived till you were 75, but how old were you when you stopped really living? And I think that's the mindset. Again, I took a proactive approach as a player. I saw players take a reactive approach to their career. They didn't play very long. And I played longer than anybody in my draft class. And I was a 6th round pick on the practice squad. And so I do think that mindset is very, very important.
Dr. Lang, Dr. Kane, so tell us it's a 80-year-old, that's a success story in your communities. And what did they do?
I have a colleague who just retired 2 years ago. Orthopedic surgeon who operated till age 84. And what he did was remain active. He exercised on a regular basis, and one of his favorite exercises was dancing. So that allowed him to stay sharp, both physically and mentally, to operate to that age. To me, Tony Magester was a success story. He's still vital, and he's not operating anymore, but I was always amazed that he could carry on orthopedic surgery till that age.
My own father-in-law that I've mentioned several times today, Pete Tidwell, is now 90 and played tennis well into his 80s. He's one of those guys that never sat still, was always active. When my kids were little, his grandkids, he was always playing with them out in the yard, throwing the football, even in his 70s and 80s. And so I think he's been a pretty good mentor as far as what activity level can do for your health, for your mind, for your health span. And even at 90, he still wants to play tennis. His body doesn't let him do a lot of it, but he's still super active, still leaves the house and drives to work every day, comes by our house and sees the grandkids every day. And I think that's really what we all want as we age, is to be around our family, be healthy enough to be independent for the most part. And he's a good example of that.
Have either of you two seen sports clinics that have really good senior care with it? Like, are your practices see many seniors?
So we do, our practice probably sees more seniors than athletes, actually, even though we're called a sports medicine clinic. But a lot of that, unfortunately, is reactive. It's dealing with knee replacements like Matt's dad, and patients that are kind of in the long-term care stage where we're trying to get rid of problems that have been going on for several years. I think it's hard to be proactive because patients usually don't come into clinic unless they have a problem to see us. We do have, we're associated with physical therapy and athletic training clinics that see patients for fall prevention. But most patients don't really seek medical help unless they have a problem. So we end up being on the opposite side most of the time, unfortunately.
We see the same thing in our office. When I see seniors, they're coming in for knee arthritis, hip arthritis, shoulder arthritis. Now, we want to treat that to keep them moving, but that's the place where we see them. Now, we also see them at all stages. It's not always surgery. We do multiple non-operative treatments to relieve pain to keep them active. But that's the point we see in an orthopedic office that you see these patients when they're coming in for the treatment of established arthritis.
I used to be in the healthcare business, and one of the things that I've watched is there's not a lot of people that are actually trying to find the cause of the problem. And a lot of it's because that's not how you get reimbursed. You don't get reimbursed to find the cause of the problem. You get reimbursed, to do a procedure. So have you found, like either of you two in your practice, that one, is there a reimbursement system to pay to find the root cause? And are people actually willing to spend the money to find the root cause of their problems?
I think just like being active in general, some of it's just personal drive, either encouraged by friends or family or other physicians. I think the reimbursement scheme, not to get too deep into a wormhole over Medicare, but I think in general, the reimbursement scheme of Medicare physician reimbursement schedules makes it hard for physicians to devote a lot of time to preventative care because the fee schedule is set in such a way that reimbursement goes down every year, costs go up every year. And so I think, unfortunately, our time with senior patients probably gets less every year, even if we don't mean to. So I think there are some barriers as far as reimbursement. I think most of it is just the perception of why you go to a doctor. Most people go to a doctor for treatment of a problem, not prevention of a problem.
The one area we do have some success, especially treating arthritis in the lower extremities, is we now ask many patients for weight reduction prior to surgery. And often we have patients come back who have lost substantial amount of weight and say, my knees and my hips just don't hurt as much anymore.
Shocking.
Yes. And they often delay surgery because of that. And so we do that daily now. I'm having a discussion about weight reduction before surgery, and but it's successful. And when people lose substantial amount of weight, I tell them, you go to the front of the line. You're ready. You have worked hard, and we know that it lowers surgical risk and improves surgical outcomes. But also, people come back and say, I feel better.
Mr. Hasselbeck, you coach younger people, right? So can you tell people at the age that you know who's going to take care of their body and their mind and who's going to, unless they get a surprise injury is going to have a longer career in sports than the people are not?
No, I don't think you can tell that, but I do get the exact same questions from parents of high school athletes as I hear when I'm talking to my parents and their friends. It is around supplementation. It is around nutrition. A lot of times it's these questions about protein powders. It's about creatine. And there really is a stigma around supplements because it is the wild, wild west. It's not regulated. It's not, you don't actually know what's going into some of these supplements. But I would also say that I think it's really important if you have to supplement extra protein into your diet, you need to do it, whether you're a high school athlete or you're the grandparent of a high school athlete. I also think with creatine, there's this thing out there where creatine makes you gain weight. And so on the same side, when you were talking about women, there's a pushback on creatine, but I think we would now agree in the medical community that creatine is really healthy and has great benefits for men and women. And so it's ironic that they're the exact same question for teenage boys is what I usually get, and for the advice that I'm giving my mom and her friends.
So yeah, I take creatine and I do protein powders. The program I'm on, I'm supposed to have more than 120 grams of protein a day. So I eat more protein than I just wish there was more different varieties so that because you get bored of the same stuff.
And I would just say, as a quarterback, one of the best quarterback coaches that I ever had was Andy Reid. And one of the things he would say is he would always just say, stay low in the pocket. I'm sure there was 12 things he could have said to fix, but he just said, stay low in the pocket. And it was a real attainable goal for me. And I think when it comes to nutrition, and I think the doctors might agree with this, or, something you're telling your patients, if it's an attainable goal, hey, I don't know if I can do everything, but I can do that. The protein goal and the exercise goal, I think are two of the simplest, most attainable, and they fix a lot of different things. I know I mentioned zone 2 cardio, good for heart health, good for brain health, which are the main things that I think men in my situation are concerned about going forward.
How important is brain health as you age for all of you?
I think in a lot of ways it's more important than physical health, really. Brain health is what allows you to be aware of your physical shortcomings, to be more active, to do things like take more protein. I would argue in your protein diet, if you're trying to get 120 grams of protein, it's tough to do. But the fact that you're trying, you're probably getting 100, which is a whole lot better than you do if you didn't know you need to get 120. So I think incremental gains, incremental things are really important. I think we know that protein, for instance, helps your cognitive health later on. And certainly from a healthcare standpoint, as bad as it is to be broken down physically, I think it's a lot worse to be broken down mentally. So I think brain health is probably more important than physical health for most of us.
Brain health follows physical health. There's been a discussion on creatine today. And Matt mentioned that, people worry about weight gain with creatine. We know that some of the older ways to use creatine included a very high loading dose. It was about 20 milligrams a day, which did cause a lot of gastrointestinal upset and water retention. Now, we know that 5 milligrams a day is probably, or 5 grams a day is probably plenty, okay? And you can get up to the levels you need, but it's going to take you about 20 days to get there, not 4 days to get there. So, but we know as time goes with the buildup of creatine, again, there's a muscular effect, and then there becomes a bone effect, and then eventually the body can get to, I will call a steady state, where there probably is some brain effect when you get to that level and you've used it long enough. So it's a good supplement and can be used by most everybody now.
Yeah. Well, thank each of you for being here. Thank you for caring. I hope our seniors take advantage of the information. But it seems to me, We all have to figure out this on our own. There's nobody's going to do it for us. So, but thank each of you for being here. Thank you for what you do.